Hey, good morning and welcome to our 49th Coffee with a Commissioner event. It's Wednesday morning, it's early, and we're very fortunate that we have a great group of participants this morning. And this is our 49th time doing this. We typically do this out in town. We go to Hardee's or Denny's or McDonald's, and we're surrounded around a table drinking coffee and talking about issues in your community and in your neighborhoods. But with the COVID-19 pandemic, of course, it's not safe to do these things anymore. Now we have a spike in cases. So the good news is we have Zoom, and we're all experts on that now. We've become experts over the last several months in Zoom and Teams and all these other online platforms. And the really good benefit to that is it reaches a lot more people. Every week that we do these, we get thousands and thousands of hits once we put it on Facebook. And so it's a great way to reach more people. One of those accidental things that we found in the wake of this pandemic. But this morning, we're very grateful to have some important staff here, and we have a special guest. Good morning, Dr. Martha Saunders. She's the president of the University of West Florida. Good morning, Dr. Saunders. Thank you for being here.
Thank you. Thank you for inviting me.
Absolutely. And then, of course, we have our Escambia County Administrator, Janice Gilley, and we have our Escambia Emergency Management Director, Eric Gilmore. And the way we typically do these things is we'll start out and we'll give our administrator a moment to update us on important county issues, and then we will go ahead and flip it over to Eric Gilmore. He's got some things to discuss with respect to the COVID pandemic, and also some things brewing out in the Gulf of Mexico and some things coming potentially our direction. So look forward to hearing that. And then, of course, we're going to get into a back and forth discussion with Dr. Saunders about how she is planning to start the fall semester at UWF and in the midst of the pandemic, and what measures they're taking to keep their staff and students safe. So appreciate everyone being here this morning, and we'll start it off without further ado with Janice Gilley. Good morning, Janice. Thank you for being here. How about an update from the county?
Yeah, so I still want to continue to make sure that everyone is following the Mask Up campaign, and then also making sure that you're following those 3 C's that we've been promoting, which is avoid closed spaces with poor ventilation, crowded places with many people nearby, and then close contact settings such as close range conversations. And then, as always, we would ask people to, continue to stay clean, try and find ways to make sure that when you wash your hands, wash it for at least 20 seconds. Some people say sing happy birthday. There are other things. If you are sick or you have symptoms, please don't go out in public, stay home, and avoid the contact or the spreading potentially of the disease. We have, as the commissioner mentioned, we have had some more cases and some spikes in our community. We've also seen those cases at our jail. We have 132 positives, 51 negatives at the jail. And then we've had over in Walton County, we've had out of the 146 inmates there, we've had 29 of those test positive. So we are continuing to monitor those. At this time, we have still not had any of those inmates be hospitalized, and we've not had any of their symptoms that have gone beyond anything other than something maybe potentially mild. But it's my understanding that at this point, they are all still holding strong. We've had, unfortunately, a large number of our corrections officers have gone out and have tested positive, but we've also had a lot of them they've been returning. So we are getting to better numbers back at the corrections officers back at the jail. And then, as we've mentioned, our road camp, our work annex has been, quarantined for these 2 weeks. And so we're looking forward to them being open next week again, because we do have like 131 crews that go out and help with all kinds of projects around the county that are very, very vital and important. And then always we like to talk about all the different ways that you can get testing. Always Ascension Medical Group, Community Health Northwest, is continuing to fan out amongst our community and, provide those services in the actual communities, not just on Jackson Street. Baptist Healthcare is available. We always have the UWF testing site, which is wonderful. And then we have the FDOH parking downtown, the FDOH downtown center is available. And then, as many of you may have seen, Senator Broxson attended our meeting last week, and he really encouraged the county, the commissioners, and any other elected officials along the Panhandle to join him with One Blood. And we are actually hosting a blood drive, for the antibody and the blood donations this next week. and every slot that we had has already been filled. It was filled within the first couple of hours. Yeah, so we may actually have the blood mobile come back. So I just think it's wonderful that our community is finding a way to rally around this unfortunate situation and try and help each other out. And, I would just mention again that, we have had numerous sources, be very clear about the fact that when you cannot socially or physically distance, that you do need to wear a mask to protect yourself and to protect others. And we just appreciate folks doing that.
And Janice, just to elaborate for the folks who may not have watched the meeting, I just thought that was really fantastic that Senator Broxson came to the meeting, and he came with kind of a different strategy that, a lot of folks are looking at social distancing and the mask policies and things like that. He just kind of went a different direction, and he found something that's universally accepted. There's no controversy. Apparently, they take the blood, they spin it, and they get the plasma, which contains the rich antibodies, which is really found acceptance around the country. And apparently here in Florida, it's working very well. We just need folks that have the antibodies to go give the plasma and blood. So I really appreciated him coming. That's a non-controversial thing. I mean, it's hard to find anyone who would have fault with that. Of course, the whole idea of mask wearing and making that mandatory is very polarizing, but I really just appreciated Senator Broxson coming in. So again, for people watching, Janice, how can they get involved? How can people watching this in the community make a difference and get involved in this?
So what they can do is they can call OneBlood. Their number, well, let's see, the best way to do it is to call them and schedule an appointment. And you can go to oneblood.org to schedule the appointment. And that would be one way. Another way is whenever you see the blood mobile, knock on the door and say, hey, I'd like to schedule an appointment while you're in this area and help out. And I do know that Senator Broxson was at the Okaloosa County Commission yesterday. I think he'll be at the Santa Rosa County Commission on Thursday. So he's definitely taking his message all throughout the Panhandle and asking folks to participate. And I just think, if you remember after the NAS shooting, remember OneBlood was just overwhelmed with people wanting to support. And so I think this is a great opportunity for people that are sitting around saying, what can I do to help? I think this is an excellent opportunity for people that can donate and hopefully maybe have the antibody to help everyone.
And on the subject of our Mask Up Escambia campaign, I think it's been very well received. And, of course, it's non-scientific, but I do shop at the same grocery store every week. I do the shopping for the family for a number of reasons. But I have noticed, and of course, the store that I shop at is Pine Forest and 9 Mile Road in the county, not in the city. And prior to the Mask Up campaign, I would say it's probably 65% of the folks in that store. This past Saturday morning when I went there, it was over 90%. I only saw a handful of folks without it. So I think the message is really hitting home. And the message is follow the CDC guidelines. Every single one of us on the dais, I mean, it was a 5-0 vote. Of course, I only speak for myself, but the vote spoke for itself. Every single one of us agrees with that, the social distance, the wearing the masks when you can't socially distance. The campaign, I believe I've seen it on billboards all over town. It's been in the News Journal. It's on the News Journal site. I believe it's been on Rick's blog, North Escambia. I mean, the message is out. And what we're seeing now is that a lot of the businesses who are making this a mandatory thing for folks to enter, they have the right, and they've always had the right to do that. Remember, no shirt, no shoes, no service. Well, they can say no mask, no service, and a lot of them are. And so, again, Janice, I think everybody in the county knows we take it very seriously. We're providing masks. I mean, don't we have 20 or 30,000 masks that we're going to distribute to our citizens who want them? So we're giving masks away. We're explaining the importance of the CDC guidelines. We're seeing businesses in the county that are enacting their own policies, which they can do legally. I've checked with Allison Rogers. They can do this legally under, of all things, the Americans with Disabilities Act. And we talked about that at length. And so I say all that to say, the Board of County Commissioners takes this very seriously. We want our citizens to be healthy. We want them to be safe. And, I think the consternation has been whether or not to make it an ordinance that's punishable by penalties. And I think that's where the rub is. But I will say this, I'm fairly certain that topic will come up at our next meeting on the 6th. I know that the City Council has made a recommendation to us, a formal one, and they voted on it. So I want everyone to know I'm open-minded. I'm not closed-minded, but I do believe that the tack that we have taken is the appropriate one, given the feedback that I've received. But I am getting a lot of feedback from doctors, others, big business leaders that really would like us to make it a mandatory thing. So I believe we will have a discussion of that on the 6th. I don't like to deal in absolutes. We'll look at the data, and we will look at other areas that have been masked up for a long time and see how their infection rates are. And we'll look at all of that. I certainly won't make a knee-jerk vote, but I just wanted that out there for the record. And I apologize going off for a little bit of time. On the subject of COVID, Eric, looking at the dashboard this morning, we got about 55,782 tests, which is an incredible number, incredible proportion of our population. Looks like, unfortunately, we're up to about 6,074 cases, 281 hospitalizations, and unfortunately 62 deaths. But I want to flip it over to you, Eric. Can you elaborate on those numbers and talk to us about hospital bed availability, ICU availability, ventilator availability?
No problem. So we did add the events to the board last week. So it's under the tab with the bed of what's COVID positive in the hospitals. So that there's been a lot of questions about the COVID hospitalization rate. That is a daily snapshot of what the hospitals report to us. So that is true COVID patients in the hospital at that time.
And what is that? What is that right now, Eric? How many are sitting in the hospital?
Right now we've got 244 in the hospital right now, and that's yesterday's number now. So
Right.
it changed today. Everybody needs to understand that these numbers fluctuate throughout the day. We only take a snapshot one time a day is when the hospitals report that number to us. So we just take that number they give us at that time and give you a daily number. So you just get an idea of where we are. People might discharge throughout the day and they might intake throughout the day. So it goes up and down, but you know exact kind of roundabout where we are with COVID patients in hospitals. And something else, that's not just the Escambia County residents. We do have a regional hospital system. That's a COVID patient in a hospital. So they could be from anywhere. So that's just not Escambia County. The hospitals don't report in Escambia County only. So we take that number and say, well, we're just taking a snapshot to show you how many COVID patients are in the hospital right now. We do have ICU beds on there. You see the ICU beds are low this morning. I think there was 4 yesterday that was available. And once again, an ICU bed is a bed that it can turn a regular bed into an ICU bed, depending on the equipment and staff that they put around that bed to make it an ICU bed. So, and we do have quite a few beds available in the system that we have here in Escambia County. I think there's 300 plus beds available that were not being used in the system. So we meet with the hospitals weekly. We have a weekly call with the hospitals, the CEOs. They've been great partners. They tell us where they're at. At one time, their biggest concern wasn't equipment or beds or anything. It was staff, like everybody else.
Right.
Staff. They feel like, as one of the hospitals reported, they felt like they're getting their staff back now. So they're feeling a little better. They're getting a little breathing room, that they all went on a 14-day hiatus and now they're coming back. So that was the biggest concern they had. And all the hospitals reporting that they're doing fine right now. They're still green. They haven't implemented any surge plans. They're still maintaining what they have right now. So, and that was the report.
Well, wait a minute now. Eric, I don't mean to contradict you, but I did hear that they're in the yellow, and that at least one of them had implemented a portion of the surge plan with respect to elective surgeries.
Elective surgery, yes, you're right. West Florida did cut out elective or minimize elective surgery. So when I say good to go, they still have the availability to surge further into the hospital and meet the need if needed be. So, but right, one of them did. Several of them have scaled back on elective surgeries, but haven't stopped it also.
And the ventilators, I know that we've consistently maintained more than 100 available. Is that still the case? 130, 140 last time I checked?
Yes, sir. That was as of yesterday. There was still 130 plus. Yes, sir.
Okay. Well, I'm going to bounce it back to you, but first I want to go to Dr. Saunders because, we all watched the Escambia County School Board yesterday, and they pushed back the start date for their school, and I think that was a wise decision. I think there was a lot of uncertainty, particularly as we look at that study that came out of South Korea 3 days ago. Very intriguing, because prior to that, the thought was, well, children and young adults don't spread it. That study was intriguing in that the 10 to 19-year-olds spread it just like adults do. So I think folks listened to that and they looked at that. And so with UWF and your fall semester coming up soon, I know that you guys have already implemented a number of strategies. Can you just tell us and walk us through like what you've done to date, and if you're watching and contemplating pushing back the fall semester?
Sure. Well, in towards the end of March, we had what we call the Great Skedaddle. and the call came down to, take shelter because of a pandemic, and that is what we did. We sent as many of our students home as we could. Some of our students couldn't go home, so we never fully closed. Sent employees home to work remotely, and greatly reduced our operations on campus, but we never fully closed. We went on to online. Our students finished their spring semester online. And I think it was sort of an interesting testimony to the resilience of the university, is that we had fewer students withdraw spring semester than we did the year before.
Wow.
And so the students stayed with us. The faculty were awesome. A lot of that was because we had already planned for this kind of disruption. You know, we do have hurricanes in this neck of the woods, and sometimes universities have to close down. So we were already ready for a disruption. Summer, we've been completely online, and enrollment is up. So again, the students are staying with us. But we're getting ready for what we are hoping is, more normalization of operations in the fall. We've been working with the state university system. All 12 universities have been working to have not identical, but complementary plans for reopening. And we're all very, very different. And so I put together a task force to help us plan for reopening. We adopted that plan, our Board of Trustees did, and the Board of Governors did at their last meeting, or a meeting before last. So we're geared to go. And one of the things that, we have to think about is our reason for being here is to provide high quality undergraduate and graduate education. So when we started effecting the plans, we started with, how do we do that safely? And
Right.
so we started with the courses. We have a curriculum. We know what people are supposed to learn. And so we worked with the faculty and the deans and the department chairs, and we said, okay, which of these courses should be taught face-to-face? Just, they can't be done effectively, because, if nobody's learning anything, there's really not a lot of point in being here. And so, but which of these must? And so we sort of worked it, we built it up from, these are the ones that really need to be taught face-to-face, and then work together to create a fall schedule. It is not the one we would have planned a year ago. And we do have more online courses, but we're also planning a number of face-to-face courses. The students will be separated, physically distanced, masks are required, all the typical protocols that we're all seeing and advice we're getting from CDC and Department of Health. And then we're also having a number of courses that we're calling hybrid. I'm teaching a course in the fall, and the first 3 weeks we're going to be on Zoom. And this is usually a getting to know you kind of foundational part of the semester, and it's not as important that we're right in there together. Then that gives us those few weeks to see what's happening outside of us. So we're being as sensitive as we can to changes, advice we're getting, if the advice changes on how to be safer, we're a resilient group. So I'm pretty happy with our plan. We have not modified it yet. Our first class begins August 21st, which is kind of consistent with what we're hearing from the school systems as well. I worry about our employees. I often say everything's connected to everything. Our employees live in the community. Their children go to school in this community. So if their children are affected, then they are affected, and then we're affected. So we're trying to be as resilient as we can. And I just gotta hand it to the folks that work at UWF. They have been awesome.
Well, Dr. Saunders, it is an amazing campus. It's an amazing school. I'm proud I got my master's degree there. Just outstanding faculty and just an asset to the area. And one of the things that really enriches the community, and I know that I look forward to every year, is the football games downtown, in our community maritime park downtown. The $1 million question, are we going to have Argo football this year?
Yeah, that is a $1 million question. I met with our Gulf South Conference, other presidents yesterday. We are quite sure that fall sports will be delayed. Many conferences in the D2, NCAA D2 have actually canceled and moved to spring. We're not there yet. And I think everybody's hoping for the great miracle that floats down out of the sky and all this goes away.
I am.
And, a year without football is just about unthinkable down here in the South. But we're ready. We're, the athletes are starting to come back and do their workouts. And so we watch and we wait. But there will be a point that, as other conferences make their decisions, then we'll have to make ours. But I think we're most certainly looking at a delayed. That means we won't start on Labor Day. It may be after that. So.
Sure.
I
was going to ask
all fall sports. Yeah.
All fall sports. A number of other jurisdictions, states, counties are looking, when it comes to starting schools, at a number of new cases and a reduction to a certain percentage before they will start. I know that you're probably having those discussions because August 21st, is it regular in-person classes at UWF? Is that the plan as of right now?
Well, it depends on the class. It depends on the class. Some will be regular in-person. And again, we have the classrooms configured so that, the seats are separate. We do screen every day. Anybody that comes on campus does a screening survey. Yes. And and that is self-reported, but it does give us a good start. We provide masks for everybody, all of our students, all of our employees. And if you forget your mask, we've got them in the vending machines. So you can
Oh, really?
You can always get one.
Wow.
And I have a few in my pocket just in case. So we're doing that. But one of the things that's a little different about us, it's not just the community. Our students come from all over. Yeah. And so we are, what our chancellor called, the Great Migration. We're going to have about 400,000 college students in the state of Florida that are moving from where they are to where they go to school. So they're bringing with them the situation in their own communities. So what's happening right here is not the only thing we have to consider. We have to consider where they're coming from. And so we're putting together our own, I guess, very tight protocols for the campus because they're coming from other places.
Well, Dr. Saunders, that's a great point that you bring up because it appears now that that's not a problem. I mean, it appears now that it's a problem if our students want to go somewhere else, right? I mean, if you're from Florida, it's like,
there are worse places.
Yeah. Oh, no, I believe that for sure. But I mean, being somewhat facetious, but it looks like apparently in Europe now, the European Union, they don't want people from Florida. I've heard other states up north now, they don't want people from Florida. So, if you have students that are going, overseas abroad learning, I mean, I'm sure there's probably some implications there. If they're not able to go, I guess you'd make an accommodation. And when you talk about classes, you've got a great facility up there, giant buildings. You mentioned earlier, so the classes that are going to be in person, you guys have already devised a strategy to make sure that there's 6 foot of okay, you've done that.
We have, and we're known for our small classes anyway, and small classes mean small classrooms. So we've really had to whittle down, maybe a classroom that comfortably housed 24 can now only have maybe 12, but we're arranging our schedule so maybe the classroom next door has the rest of the students, and we've installed cameras in all of the classrooms so we can
Wow,
at least
okay.
be videoing what's happening. It's not a perfect interactive video, but it's pretty good. And then we're also doing seat reduction, whereas the faculty member may teach half the class, one class meeting, while the others are watching, and then the next class meeting they flip. And so, and a lot depends. I mean, you know, our many of our faculty, you know, they are caring for elderly parents. I mean, they have their own,
Yeah.
you know, in the middle of a crisis is one person in a crisis, and we all have different challenges. And so it's possible the students may be sitting in the classroom and the faculty member will be away and on Zoom. So it's all going to depend, but you know, the end goal is our learning objectives. And those are things
Yes.
that we measure all the time. Is anybody learning anything? And that's what matters.
And, you know, when you sit there and you think of all the different sorts of college classes that you teach, and you think, well, how in the world could you take a violin lesson? And then the way people have adapted is just really amazing to me, and what you see online and then what you see in some of these massive open online courses. And it all seems to be blending together. But to me, it seems like some of the physical sciences, like the labs in particular, with some of the chemicals and specialized equipment, I don't know how you'd ever be able to do those sorts of classes online or in a distance. So I assume like your labs, your chemistries, your courses like that, you got to find a way to do those in person, I would assume, right?
Yeah, our labs, we're doing the lecture portions online, and then the students will come in person. You know, there are just some things you don't want kids doing in their garage, like, you know,
Right.
chemistry experiments. And so, what our chemistry chair was telling me, they have just, you know, they've just been so creative. They know what they've got to learn. And so they say, all right, we can do the lecture part online, and then we'll bring them in to do the actual experiments. And those will be done, again, following all the best protocols that we can find. So it's going to be more work. It's going to be different. It's been challenging, but it's just also such an amazing opportunity to learn new ways of doing things. So you know, I'm not at all discouraged.
No, you got the right disposition. Hey, and on that topic, you know, when we're looking at this horrible pandemic, and it is terrible, it's taking a really devastating impact on people's health and the economy worldwide, but you are in charge of a college. You're a president of a college. Is this an opportunity for folks, say, in the statistics department or in some of your research fields, disciplines, to take this and create a learning situation and perhaps find a way to really analyze data to help find solutions in real time as part of the learning in the curriculum? Are your professors looking at kind of interesting stuff like that?
You know, it's a gold mine for researchers, a gold mine when you look at behavioral research, when you look at climate research. I mean, we have a greater reduction of air travel. Is that making a difference in the climate? And if I weren't doing this job full time, you know, I would really, you know, my husband and I do a lot of reading about aging in place. Well, we're now realizing, you know, people who may be vulnerable are in their houses. What kinds of technology can we use to keep them safe? How can caregivers stretch themselves to make sure that the people in their care, you know, are being protected? So there's just a wealth of research to be done. I'm just really curious about fashion changes. You know, I think
right.
You know, what we used to think of as professional attire looks a whole lot different. So, you know, I think we're going to see great transformations.
I just hope it doesn't come to the point where the fashion is you have to wear an astronaut costume to teach a college class. I mean, we hope it doesn't come to that.
I do too, but people are getting pretty creative.
Well, and I want to get back to the in-class experience. So you've got small classes, you've got the 6 foot of separation, either, physically, or you've got cameras and people in the other room. So with the 6 foot of separation, what is the UWF masking policy? If I know that policies change from place to place. Like, for instance, in the city, I was at a restaurant in the city on Sunday. I'm not going to name it, but it's a pretty popular one that a lot of people go to. And part of it's indoors, part of it's outdoors. But in the city limits, with their very, very onerous mask ordinance, half the people weren't wearing masks. And the ones that were, many of them were half maskers, whether it's below the nose, and then
Chin straps.
the full maskers. I love the ones who wear the mask and it's below the chin and they're talking and they're wearing the mask. I'm like, what's this all about? But so, I mean, I just think it defeats the purpose. But about half of them were, and other people weren't. And then they dutifully put the mask on as they walk to the indoor portion. And then they take off the mask and they're carrying on and laughing and talking. So I really I'm not a scientist. I'm not a medical director, doctor, anything like that. I'm trying to read every piece of research, but I'm a people watcher though. And when I'm being asked to institute a mask policy and make it an ordinance, I'm looking at places that have, and they're not enforcing it. And worse than that, they're not wearing the masks properly. So what is UWF going to do? You're going to have 6 foot of separation. Are the students going to be required to wear the masks as well?
In a shared space, our protocols today, and it's been really interesting as we have brought employees back on campus, as we've built into phase 1 of our reopening. If you're in a shared space, you wear a mask. And then you have, if you're outdoors, I see people walking around, they've got them in their hands, but if you're outdoors, unless you are in close proximity, but I watch people by my office is right by the nature trail, and it's kind of interesting. Like you said, people watch, everybody's got one in their hands. And then, but especially indoors, shared spaces, if you're in your office by yourself, of course, you don't need to, but if you share the space, we expect you to wear a mask. And I've been, I walk around a lot, and it takes getting used to. It just,
I know it does.
And I think we all still feel like bank robbers, when we're wearing a mask.
Right.
Oh my gosh, but it takes a little getting used to. And yesterday in particular, when I was in the office, I noticed we've gotten used to it. And somebody walks in my office with a mask, I don't sort of start, and I have mine with me all the time. So that's the protocol today. And then as we get more people, we will, be more mindful of that. So that's how.
You bring up a good point. When this whole thing first kicked off and folks started wearing the bandanas and everything around, and then you see the people with a face bandana and then a hat on, and then you see the people with a face bandana, a hat, and sunglasses. I'm like, if I'm a bank teller, I'm like, are you a robber? Or what's this all about? I guess things are changing, and you just got to, get accustomed to that. But so you are in indoor spaces and shared spaces. The mask is mandatory. And Janice, in the county, that is our practice as well. I mean, there's been a lot of rumors and misinformation. So Janice, clear it up. What is your expectations of your employees in the county with respect to masking?
So I have had several conversations with our directors. I'm allowing the directors to manage their departments. And I did want to mention one thing about the masking. So what we have done is we have actually filmed the proper way to wear a mask. FDOH has one, but we also have one that we're working on that we filmed yesterday with our EMS director to make sure that we can also demonstrate the best and appropriate way to wear a mask, just so that people know that it's probably not helping under the chin or under here, just trying to, again, give another example of how you do that. But I did want to mention, so for example, for the county departments, the chief at the jail has mandated masks wearing by the employees at the jail. If you do have an exemption, then you do have to document that exemption. Then we've also had, the bus drivers have actually they were mandated by the director back in April to wear masks. We've also instituted it where when you have 2 employees in a vehicle, if they're riding somewhere,
sure.
or more.
They have to wear masks too.
Yes, sir. I've been to COC a couple of times in the past couple of days. I wear a mask when I go in. The ladies at the front desk are wearing a mask. Most of the people that are coming in contact. So our guidelines have been for months that if you don't have a plexiglass or something that you feel like is a protective barrier and you are not able to socially distance, or you are having constant contact with the public, that we are asking you obviously to wear a mask. But if you are, like Dr. Saunders said, in your office, or if you're not up walking around the building, you are welcome to not wear a mask, you know, if you are by yourself and working like that. So there hasn't been a mandate per se, but, you know, I just want to speak to that in the sense that I feel like our main goal is to get to the heart of people and to ask them to obviously love one another and respect one another. And I think that's a more successful way to have this be accomplished. Because I think when you put mandates like employees, I think that a lot of our directors could spend their time disciplining. You know, now when you put the mandate in, now you're required to discipline somebody when somebody says they're not following the mandate. And so what we would rather do is go the positive direction in the office and say, you know what, if you can't protect yourself and protect others, you know, we've got a problem. And so right now our directors are handling it that way. But we have had numerous conversations about what discipline would look like if people, you know, aren't able to follow the guidelines that we put into place, and then what it would look like if there was a, you know, flat out mandate. And so, like I said, some of the directors have already made, you know, mandates, mandatory mask wearing, and, you know, they're still dealing with those same issues of individual employees saying, I have a medical condition, I have a, you know, fill in the blank, and having to provide that documentation. So, and I don't know if Dr. Saunders is having to deal with that as well, but there literally are people that truly do have, you know, bronchial issues or other things that do limit their ability to be able to wear a mask for long periods of time. So
I never knew much about it, but my father, before he passed away, had a severe lung condition called COPD. And I mean, things we take for granted, for instance, just how you sit, the way you keep your legs. I learned so much through watching him struggle with this and different breathing exercises, but he would tell me certain shirts, if they were too tight, he couldn't breathe. You know, he would feel it. He would have to wear very loose fitting clothes. He would have to keep his legs from being crossed. And so I know there are folks out there with these diseases and these complications. You see them with the, you know, with the swinging transfusion trees and the oxygen tanks and everything. So the fear that I have when you go toward, you know, the mandatory side of it, either people will be ostracized, and, you know, unless they have a physical oxygen tank, and then you say, okay, well, but if you don't, but you have COPD like my dad did, I mean, are you going to be mask shamed? Of course, we've seen those videos and things of this nature. So Dr. Saunders, how do you address that? If you have a staff member, a faculty member, or a, you know, custodial staff or facility staff, do they have to document their reasons for not following the mask mandate?
You know, if they cannot or believe they cannot wear a mask, then that's handled individually. We have a number of protocols with, you know, through our HR, and it's outlined in our plan for reopening. We're in phase 1, and that's bringing the employees back. And then, and you know, if it's documented, and there are various approaches. If they can work remotely, we try to make that happen. There are some jobs that just can't be done remotely.
Sure.
We try to find a solution for them. So far, I have not gotten any reports of any, I'm gonna call it contrariness. I think we all need, we know we're in this together. And so it's been a lot of what Janice said. There have been gentle reminders. And because a lot of this is just a habit. We're having to form new habits. And
Yep.
New habits take time, and it helps if someone says, now don't forget, you've got to do that, and to model it. I put my mask on before I get out of the car, even though I don't technically need to have it on. I think it's important that people see the president walking into her office with her mask on, because that reminds people, hey, you know, this is it's just what I need to be thinking about doing. So far, we have not encountered any particular issues. Yeah, again, if there's a health-related issue, we have worked at it, and I've not heard any, we've been able to deal with it so far.
Eric, over there in emergency management in the EOC, what is your policy? I know that's your shop over there. Do you mandate that folks wear the masks over there?
So, like everybody else, when you're in your office or in your space, mask is not required. But as we walk throughout the building, out of respect for each other, everybody wears a mask throughout the building. So we are doing that. You know, we were doing temperature checks a long time. Starting March, we did temperature checks coming into the building. And that was somebody putting an infrared thermometer up to your forehead. And we since bought, it came in last week, and we have a thermal imaging camera now. So we funnel you into the center of the lobby, and you come in and it takes your picture and your temperature right then and there. So we don't have to have somebody come right up to you at your forehead and take a temperature anymore. So that's what we're doing. So yes.
Yeah. And whenever we found out that some of those were available, we did order about a half dozen of those, so that, and that's been several weeks ago, so that whenever they came in, we would be able to put those around the county buildings that we have. I have also talked to the constitutional officers to see how many of them need them. And then also the courts got one a couple of months ago as well. So we are trying to go to that. Two things that keep somebody from having to be really close to someone to take the temperature.
Mm-hmm.
And number two, it also gives you an opportunity to do it in such a way that you don't have to have somebody sit there all day, you know, and
Right.
that takes two people, one person to continue to do the regular reception work and someone else to do the thermal imaging. I mean, the test taking.
Those
Well,
units
and
are
those are-
portable too, so you can move them around, which is great. Yeah.
Mm-hmm.
Do you have those out there? At
We've ordered them
university?
for key parts on the campus, especially where we, like our commons area, where especially where we think we would see large numbers coming in at the same time.
And so this is like a scanner. Is it like what you have out there? Is it what you see in some of the Asian nations where folks are walking by and they all look white, but then the red one walks by and you know that one is that what we're talking about here? Or are we
I've not used it yet, and I know there are various kinds, but we've taken some recommendations from a couple of the other universities, and they're pleased with theirs. So when it gets here, I'll take a picture and let you know.
Interesting. Well, I'm sorry, Eric. Did you?
Ours is a camera, so it looks just like a camera. It's on a tripod right here in the lobby on the front desk. And a lot of people don't even know that. And so we installed it Friday, and throughout this week, we've had a lot of people come in and get their temperature taken. And the front desk will go, "You're good. We've already got your temperature," because they're used to coming up and walking up to her and getting her, you know, the infrared thermometer. Everybody's, like you said, creating a habit, right? So everybody's used to walking up there and getting their temperature taken, and they're saying, "Where did you take my temperature at?" And so when you walked in, the camera caught you. They're oblivious to it. So anyway.
No, that's incredible. So if I'm walking around with 102 degree fever, but I really want to go to work because for whatever reason, I don't care about other people and I need to make money or whatever, that's going to catch me going in the door. You're going to say, wait a minute, who's watching it? Who's monitoring that, Eric?
So we're still working on the software, but it's got the ability to, we've got parameters set. So at 100.4, that's where we identify as a fever. So if it reads you, Commissioner Burgash, if you walk in the door and you're over 100.4, it's going to take your picture and it's going to email it to somebody to come get you. And we're going to recheck with a thermal infrared just to make sure. And if you're still over temperature, then yeah, we oust you out of the building. So
are you kidding me? It actually takes my picture and then recognize my face? What if I'm not yet, but I'm just
it's not real fake. It's not. So it just takes your picture. So we have to walk the building and try to find, typically we know who's in the building. So we just try to
I hope so.
So yes.
Wow, because that sounded pretty Orwellian there, man. I was like, wow, that's the high-tech stuff. They're going to get you. They're going to know you. Boom, they're going to come to your house. No, that's all.
Too, that when you're talking about emergency management, that Director Rogers did, enforce a month ago, that all EMS and all fire, should wear their PPE all the time. Previously, it was if they were going to a call in which there was a suspected case, but now the way this has transpired and kind of changed, it's now all the time. So if they're, if all the firemen are in the vehicle together, or, whenever the EMS are in the vehicle together or responding to a call. And he, oh, by the way, is surprising and showing up on different calls just to verify that they are
Oh,
doing.
is he? That Jason's doing that? That's
Yes, sir.
fantastic. That's good.
Yes, sir.
I love to hear that.
ended up on a couple of calls on the beach and some other places. I mean, just because he likes to go to calls, number one, but number two, it served two purposes. So he got to be at the call, but also verify that PPE was properly being worn.
Wow. Well, see, that's important to do that. Well, I mean, I want to point out for people that are watching, again, talking about the masks, because it is the topic du jour. About half the country, a little over half, have implemented statewide masking policies, but a large swath of the center of the country have not. And so it's one of those issues that's it's kind of becoming a wedge issue, but just want to make sure everyone knows that I'm not opposed to wearing a mask. In fact, I've worked at NAS Pensacola for going on 16 years as a contractor employee. And when the skipper made that a rule, we all put the masks on. I got 2 in my truck. I got them in my office. And any time I cannot socially distance, I wear the mask at the post office. If I go to the exchange, anywhere on that base, any facility, we wear the mask. But the critical thing, and what I want people to know is, it depends on your environment. If it's enforced, and on NAS Pensacola, it's enforced. If you don't do it, you're off the base. Goodbye. See ya. They have, security forces, shore patrol, and then they have a very authoritative command structure. So if you're happen to be active duty, so in that environment, I mean, it works. But the concern is if it's something that's not enforced, and so that's why I've asked the questions I've asked of you, Dr. Saunders, and you, Janice, and obviously given the anecdotal evidence that I've seen in the county with our campaign and what that's doing to people, and what I've seen in the city downtown and people not wearing the mask. So I'm not opposed to it. In fact, I support the recommendations. Am I sold on the science of it? I'm not, because as we saw, Janice, you were on the Coffee with the Commissioner in late March with Dr. Lanza, one of the first ones we started doing live, and we had a question. We had a question from a cashier at a grocery store, and you can go back and watch this. It's on tape. And the question was, ask Dr. Lanza, I really want to wear a mask because customers are coming in and they're sneezing and coughing, and I want to protect myself, but the manager of my store won't let me wear a mask. I don't know if you remember that, Janice. Mm-hmm. And Dr. Lanza looked me right in the face and said, Jeff, tell her no, because it doesn't provide protection. We never tell people to wear a mask unless you're sick. If you're sick, we tell you to wear a mask, but it doesn't provide protection. And so we've gone from that to now we think you should wear a mask to now everyone must wear a mask and make it a law. It's just a big change for a lot of people, and a significant portion of the people in my district do not want it. I know a significant portion do. So I think, Janice, what we've done with our Mask Up Escambia campaign is we've said, listen, we agree. Where we have a disagreement is whether or not it should be, enforced by the police and result in citations or notices to appear or maybe fines. That's where I think we're going to have a discussion on August 6th, because, depending upon what happens with this, and this is the next question that I want to go to, and I want to go around the room with you all. We see the governor yesterday says he thinks we're starting to see a leveling off. I don't know. I guess the numbers will tell, but I want to ask each of you this question, because here's what's concerning to me. If we can't get this thing under control and we have to shut this economy back down again, what will that do to our economy? We've rebounded with the jobs. We're down to about 7.5% unemployment, which is not good, but it's better than 14% here in Escambia County. But if we have to close down the businesses again, what would that do to our economy? So I'll start with you, Eric, and we'll go right around the room. Do you think we will have to shut this economy down again? I mean, what's your sense of it? You're looking at these numbers every single day.
I don't think that we'll go back to where we were. I think we'll start scaling back certain things that we're seeing, the large congregations. If we start seeing, like football and, large gatherings and stuff like that, and we start seeing the numbers increase more, I would expect to see those things scaled back and stop. But as far as going back to where we were in March and April, I don't think that we'll get back to that exact point where we're totally shut down, safer at home order, and non-essential businesses not operating. I think they'll do some things to, try to protect, social distance, minimize the occupancy of the buildings like we've been doing, and try to enforce those a little better or make those a little bit more enforceable. But I don't think we'll go back to where we are, but I do see that the large gatherings, the sports venues, if we start seeing large numbers, those things where we're getting people together will absolutely come to a halt. So.
Good answer. Janice, what's your thoughts?
Well, I was hoping Dr. Saunders would go next.
No, you got to go first.
Yeah, well, because this is the thing. I think that Dr. Saunders has a college, an entire college that could help us answer this question. Rick Fountain and the College of Business and, SBDC and all the people that she has, the intellectual capital that she has could help us answer this question, obviously more, probably better than I could for sure. But, I have been doing a lot of research as well, and it does appear that we might be in this thing for a full year. There's a speculation that we're going to have spikes in October and things like that. And then also what we would regularly see, the flu season. So I think I want to go back to what I said about people's heart. If people will respect each other, love one another, and truly think about the consequences of the spread, then I think that we have a better chance of managing this, because I don't think it's going to go away. And so part of that management is what we've said: make sure you don't, continue to be in confined spaces, do the spread and things like that. Like what Eric said in terms of, large gatherings where people are kind of unprotected, for lack of a better term. And so I think it's all incumbent upon us to help manage this spread. And if we manage it, then I think obviously essential businesses and places that we rely on to, whether it be building and construction and food, medicine, those kind of things, we can keep those things open. Unfortunately, there may be, I hate to use the word collateral damage, but there may be things like, unfortunately, Foo Fest or the Great Gulf Coast Arts Festival or fireworks. Those are the kind of things that we probably won't be able to participate in or maybe see unless we just see a huge dip. So I think, and I forgive the term collateral damage, but on the other hand, that could be what it is this year for some of those activities that we're used to. But if we manage it, I think the things that are essential and important to sustaining us as a society and as a community, we can continue to have open.
Thank you for that. And Dr. Saunders, what's your take on that? Do you think there's any chance at all we have to do a hard shutdown again statewide?
I hope not, and I don't think so. I think as we are developing what I call common sense measures, we're listening, we're learning, we're adapting, we're listening, we're learning, we're adapting. I don't think we'll see that. I do think we're in for what I'm thinking is maybe a 2-year drought. Economies don't collapse overnight, but they also don't rebound overnight. We had a pretty severe hit when everybody went home and quit working in March. And so I think that, and if we reduce the numbers of people who are going to events, then you have reduced the revenue that event generates. And so there is going to be a reduction, but it just doesn't feel like a total collapse. I think there may be some tightening of the belt. There may be, at the university, for the last 2 years, we've been working to stabilize, make sure we plugged any holes in the boat, because these kinds of things happen. And we usually have a bit of a lag time. We're hit a little late. I mean, our summer enrollment was up, fall enrollment looks strong, but will that hold? If parents lose jobs, just like we saw in the recession, that's going to influence whether kids can afford to stay in school, and there's a domino effect. But I do think we need to be serious about our planning and our adapting, but then to just use common sense and say, look, we are all in this together. We are. Even though I can control and influence what happens at the university to a certain extent, once you hit that campus, they're not prisoners. And so, and they can
That's
go
right.
other places and do other things. And so it is important to teach that. And it's what I call a teachable moment. And we're having a lot of those now.
Oh, are we ever? Well, Dr. Saunders, just a tremendous respect for you and what you've done out there with the university. And Dr. Bentz before you, I was a big fan, bringing the football, everything that's happening. We're so fortunate in this community that we have great things like the University of West Florida right here in our backyard. And frankly, all over the community. You're downtown now, too, with your cybersecurity center and everything that you're doing. I greatly appreciate you being here this morning. And I know this has been a lot of really good information that's going to be shared on Facebook. I'm certain of that. And so folks will know that you're doing everything you can to mitigate any kind of risk for your students and your faculty. One thing we didn't touch on that I want to ask you about, I know that the campus last year toward the end, that you cleared out the residential. I'm assuming August 21st, we bring in the students back to the residence halls?
Yes, we're bringing them back. Instead of one move-in day, we're stretching move-in over a week so that we're staggering that. We also, a couple of things, and these are sort of our dashboards that we're watching. We sent a letter out to our students who had contracts in housing. And we said, we know you're making a lot of hard decisions. If you want out of those contracts, just let us know, and we're not going to charge you any cancellation fee. And we had a few, and then the surge recently, we had a few more. We're still okay. We're having more requests for single occupancy rooms, and I think as people,
I bet.
Think about that. And one of the things, but housing is still there, and one of the things that I was telling the other presidents, I said, when we sent everybody home in March, that's because we thought they were safer there. That's no longer the case.
Right.
And so that they would be safer in their own homes because of
Sure.
the spread in the communities. And we believe that with the right protocols, we can make them safer where we are.
Well, very good. Well, it's hard to believe how fast an hour goes by, but I just want to, again, thank everyone. Dr. Martha Saunders, president of the University of West Florida, thank you so much for being here this morning. Best of luck as you open the campus this fall to you and your students and your faculty. We certainly hope we have fall sports. Football, please bring it back if possible. Eric Gilmore, thank you for everything you're doing. You're keeping us up to date. You've really put a nice dashboard together, and I got to give props where it's due. Eric has worked very hard, and he deserves credit for putting together the excellent dashboard that we have. Eric, thank you. It's got just about everything I want on there. I know that there's some data you're still having a hard time getting in terms of like the breakdown of the COVID patients. But look, anyone watching this, if you want to know exactly what's happening in Escambia County, Florida with this disease and this pandemic, you go to myescambia.com and you click that link. And it's a real-time snapshot, number of ventilators, number of beds, hospital beds available, because the news media, they will spin this up and they love it. They want it to, the sky is falling. But the reality check is our website. And with the input from the board and the leadership of Janice Gilley, you put together a great dashboard. So I want to say thank you, Eric, for all your hard work, keeping an eye on the tropics for us, keeping an eye on this pandemic. Thank you for what you do. And of course, Janice, every week at 6:30 in the morning, you're a trooper on my coffee. Thank you for being here. Thank you for speaking with Dr. Saunders and roping her in to come. Appreciate it. And we're going to have a good one next week too. So I just want to tell everyone, have a great rest of the week. Be safe. And we look forward to doing this again. And thank you all for participating. Have a great one.